So we have a very large cohort of breast cancer survivors at our institution, many of whom have had actual formal survivorship visits and have filled out questionnaires reporting their symptoms and health concerns that they have. We decided to look at the experience that we've had to determine what kind of issues our survivors are facing so that we can better address their needs in the future. So we looked at early stage breast cancer patients, so stage 0 to 3, and they had all had surgery for their breast cancer, and some had had radiation, some had had chemotherapy, some had had hormonal therapy, according to their physician's discretion. So we found, first of all, that in this survivor population, there was a very high prevalence of symptoms such as hot flashes, fatigue, a lot of quality of life issues that were still bothering these patients who were seen at various times in their survivorship, some early on, some sort of a few years into survivorship, and some very late beyond 5 years of survivorship. And the symptom spectrum did change over time in these patients. Some of the interesting findings were that treatments that we might expect to cause a high burden of quality of life effects like endocrine therapy really increased hot flashes and some sexual symptoms, but not a lot of other symptoms were more highly reported in those taking hormonal therapy compared with those not taking hormonal therapy. Chemotherapy, on the other hand, had a dramatic effect on symptom reporting, and we found that 26 of the 34 symptoms and health concerns that we assessed were increased among those who'd received chemotherapy compared with those who had not. So that was really quite striking. We also looked at the effect of radiation treatment, which surprisingly was not associated with an increase in any of the symptoms or health concerns, including edema, swelling of the arm, pain issues, compared with those that didn't have the radiation treatment. In addition, we looked at the effect of body mass index, and we found that actually about 2/3 of our breast cancer survivors were either overweight or obese, and those that were had a higher prevalence of multiple symptoms and health concerns. We also found that those who reported that they exercised regularly actually had a reduction in symptom reporting. And so that was a very interesting finding because that's a potentially modifiable factor. Well, I think the main point is the strong effect that chemotherapy has on potential health concerns down the road, and the population receiving chemotherapy probably needs to be targeted for interventions on both quality of life symptoms as well as other health concerns. We're actually looking at whether an intervention with exercise very early on in the process could be helpful for some of these high-risk patients. So something that we're hoping to look at in the near future is whether doing an exercise intervention in patients getting neoadjuvant chemotherapy, so before they've had their surgery, and could start on an exercise program very early, whether that would help with symptoms down the road.